Well, while Dr. Hampton's setting it up, I know most of you are familiar with him since you're here. I am so proud to be a part of his practice. I'm both a patient and I'm also the Northside Care Coordinator. So just amazed at what kind of things that he's done. And he's also a world-renowned speaker and just got back from Miami, blushing. So, without further ado, let Dr. Hampton take over.
Thank you. Thanks. What's that?
Sometimes that
I think you're going to get to see a few things before we get my talk about the program. There we go. There are my beautiful children. Well, as Tim said, I did just get back from Miami, where we had our international meeting, and it was really good to see some of the new things going on in facial plastic surgery. And, there's always new stuff coming out. So
What's the coolest new thing that you saw?
well, of course, Juvederm is the best new thing out there, followed by Botox. Latisse up, yes. That's right. You know, there's some of the new things out there that, I mean, there are always new fillers coming out and new lasers. I mean, that's the biggest area where we always see new things coming out. One of the things that we have here that we're going to start doing is something called Volthera. And if any of you are familiar with Thermage, it's been around a long time. And it's a tightening device. There's another one called Titan. None of them have been too impressive, quite honestly. And this is the first one that's gotten FDA approval for tightening and lifting. And it's called Volthera. And we're going to start doing that sometime in the next couple of months here. So really almost no downtime, and 90% of patients see improvement. So it's been that's a good.
Dr. Hampton, am I correct in thinking that that's one of the few, you're one of the few doctors that will actually have this?
Yeah. There's a couple offices in the area that are going to have it. So yeah, so we're excited to have that coming out here soon. So as Kim said, I'm a facial plastic surgeon. For those who don't know me, Dr. Mark Hamilton, and I just do face, head, and neck. So a little different from some of the other practices that you see. I do the full gamut of cosmetic and reconstructive surgery, but tonight we're really going to focus on some of the cosmetic aspects of what I do. I think Michelle's given you the whole rundown on aging and skin care and fillers, and that is a great place to start. A lot of people aren't ready for surgery, and I recommend that's a great kind of first step if you're getting into this. But for those of you who are ready, there are options for those who want to take the next step. And you've kind of seen this in Michelle's version, just what we see with facial aging. And the big things that as a facial plastic surgeon we're focusing on is that relaxation of the tissues. We talk about aging face surgery as lifting the tissues and lifting them in a manner that is natural and that get really long lasting. And one of the first areas where we all see aging is the eyelids, and blepharoplasty is a procedure to rejuvenate the eyelid area. Been around a long time, so it's definitely a proven procedure. For the upper eyelids, and I figured out the befores will be over here and afters over here. For the upper eyelids, we make an incision right in the upper eyelid crease, and from that we can remove extra skin. And that incision does great. Really should be a fine line once it's all done with. And makeup for the women really shouldn't be visible. And then lower eyelids, in this case, we actually, in younger patients who don't have much extra skin, we can actually go through the eye to pull out that puffiness, which is actually fatty tissue. And that's what she had done. Look here, she had the puffiness here, and we removed that afterwards to tighten that area. So that's a lower blepharoplasty. And then there's a side view of that. And you can see how that opens up the eyes. Makes a difference. Somebody a little bit more extra skin. And in that situation, we'll make an incision right below the lashes. You can see it's very hard to detect there. It comes out into the corner. And from that, we can tighten up that extra skin and that fatty tissue at the same time. For most of my procedures, including eyelids, they really are kind of on the same schedule. Usually have stitches in for a week. And then after a week, day 9 or 10, we'll have you back. And Michelle or Elaine will help you with makeup at that point. So most patients by 2 weeks with makeup are really pretty presentable and ready to get back out. Something a little different, and no, she's not sleepy or on medications. That's what she looked like. That's ptosis of the eyelids. And a little bit more involved. That's actually working on the deep muscles to lift the eyes up, to open things up like that. So that's a little bit different, but there are a lot of little variations with eyelid surgery that we can do. And then something we really don't see around here very often. This is what we call a westernization procedure, or double upper eyelid. That same muscle we were talking about in Asians actually attaches down by the lashes. And we can reattach it higher up, create a nice upper eyelid crease. Kind of a fun procedure. Very common in Asia and on the coast. Don't see it here too often.
I didn't know you could do that.
Yeah.
Wow.
Yeah. So very fun. Moving on to facelift. And I can't tell you, this is the one procedure. So many women come in and they say, oh, I can't do a facelift. I can't do a facelift. And then after they do it, they're like, oh, that wasn't so bad. You know? And it really, when you talk about addressing these areas, it does a great job at softening that. And so many people say, why do you need a neck lift? Well, it's really kind of a facelift. A facelift addresses what you see here. Kind of the neck, along the jawline, and about halfway up the face. And the way we do that, you see the difference that makes on the lower face. And the way we do that is incisions around the ear. You can see here, you can see just a hint of white there, but we make incisions in front of the ear here, in the ear canal, up here, and on the back of the ear. Very well camouflaged, very hard to detect afterwards. So a well-done facelift, you can't tell somebody that's had it from their incisions or anything like that. It really is, the only way you can tell is the patient knows that they look different and their family and friends know they look different.
Dr. Hampton, how
Yeah.
far out are most of these? Are they all about 10 days?
Most of these are about a year out, actually. Now, some of these are 10 days out, and I'll tell you which ones those are. Usually we take pictures, and that's a good thing, because people always wonder, you know, am I going to see a back again? I'm continually surprised. And I guess in some places you go, you don't see the surgeon after a couple of weeks. But I see patients back continually all the way through the first 6 months to a year, because we want to see how you do and make sure it's doing what you want and what I want too. So, but she's probably a year out. That's when I take most of my final pictures there. Again, the same kind of recovery as we talked about with the eyelids. Another thing, this is one patient who's 10 days out. And if you look, you can see a little bruising, a little redness, bruising out here. But you can see how something like this with makeup is going to be very presentable in 2 weeks. The other thing we talk about is pain. And people think, oh, facial surgery, that's got to really hurt. But if anything, you're actually numb after facial surgery. So most patients, I don't want to say pain-free, but most patients are pleasantly surprised that they don't have a lot of discomfort. Tightness, yes. Stiffness, yes. But it's rare that somebody else will come in and say, well, that really hurt. It's usually not as bad as they thought. So it's fun kind of surgery to do. A little bit heavier neck, gets to be a little bit more challenging. And sometimes in these situations, we'll talk about maybe the need for a tuck-up when somebody kind of gets a year out. But with liposuction and extensive muscle work and lifting, we really can make a difference there, and she is a year out.
Where do they cut from the liposuction?
Little incision right underneath here.
Right there?
Now, if we're just doing liposuction, it's not even a centimeter. If somebody like this one, doing a lot of muscle work and lifting, it's maybe that long.
Okay.
But the nice thing about incisions underneath here is I had one from when I fell off my tricycle at age 3, and most people are saying that they have one here. So it's not something that's a giveaway for surgery, which is nice. So that was talking about the lower half of the face. Now talking about the upper half of the face, we talk about endoscopic brow lifts or forehead lifts. And what that does is raises the brows, softens frown lines, softens forehead lines. That's some people call that an upper facelift. And this is kind of the area that addresses. You can see how it relaxes the area between the brows, lifts the brows, and it's all done with incisions behind the hairline. So really well camouflaged. Very popular procedure for people in their younger years because they can camouflage the incisions easily and don't know they've done. Young patient here, lifting the brows, opening the eyes, really can make a difference.
Who is she?
Who is she?
How old is she?
Oh, how old is she?
You know?
I would say she was in her late 30s there.
I mean, remarkable
Yeah.
difference.
Yeah.
You know, I was thinking that was a bigger picture of her.
Yeah.
I mean,
Really open things up. She also had a ghost job. Yeah.
yeah.
Yeah. This is a patient who's 10 days out. Again, she also had a brow lift as well as upper blepharoplasty. It's a little incision there, a little bruising there, but with makeup. And that's the nice thing about makeup is we can have it in
Wow.
and get it fixed up to go back on to other activities. Moving on to now, most of these things we've been talking about lifting, laser resurfacing, and I heard Michelle talk about skincare and doing all those things to improve your skin. For some people, they really need and want something more. And laser resurfacing is kind of the ultimate rejuvenation for facial skin. Now, not everybody's a great candidate for it. If you're somebody who's still out in the sun a lot, it's probably not ideal for you. If you're somebody who is uncomfortable lightening your skin a little bit, or not ever wearing makeup, that's probably not for you. But for those who have deep lines and want to see a difference, I don't have anything that can take lines out like that. I mean, that's what CO2 laser can do. It really can make a difference with lines throughout the face, taking away sun damage. Really powerful technique. Now there's a little downtime in the face. You have to go through kind of a peeling phase for about a week and a half, and then repeat for a couple of months. But there's no other technique that I have that can really rejuvenate the skin like CO2 laser. Another patient around the mouth. Again, deep lines like this, there's no other way I can take care of those. And it's great for those in one procedure. And then I can do it with other procedures. This patient had a facelift and CO2 laser, and you can see that combination is pretty powerful in terms of rejuvenating the face and the neck, around the mouth.
Dr. Hamilton, is laser resurfacing whole face, or can you just do just those places?
Right, you can do a regional laser,
Okay.
but in general I don't recommend that. And the reason being, it does take some of the color out of the skin. And if somebody has any color of the skin, they have 2 different color tones in their face. And so about the only time I'll do that is if somebody says, you know, I wear makeup all the time, I don't mind if there's a little color difference there, then I think it's okay. But everybody else I try and get pushed to the full face laser.
Did she get a rhinoplasty too?
She did not.
No?
No, we talked about.
Does that big of a difference in just getting a laser resurfacing?
Yeah, that's all laser resurfacing and facelift. Yeah. We're going to rhinoplasty. This is a little different than the other surgeries, which are rejuvenation. This is something people do at kind of any time in their life. I have, teenagers come in who have been pushing their mom and dad, really want to change their nose, all the way to people who've been waiting their whole life to do it. We did one on a 71-year-old today, and there's so long. You finally could do it, and so we want to do it. No surgery is more challenging than rhinoplasty. I think a lot of plastic surgeons avoid rhinoplasty because it's so challenging. You do want to have somebody who does this on a regular basis. A lot of nuances to it, a lot of analysis goes into it. So be careful when you're deciding how to do, who's going to do that. This is kind of your standard rhinoplasty. And rhinoplasty is really making the nose fit the face. And most rhinoplasties are making, at least in this part of the world, making the nose a little smaller. We were just at this international meeting and all the Asians were talking about how they build up the nose. And they have usually a flat bridge, so they're putting things in to build it up. In general, we're making noses smaller, taking down the bridge, making the tip more defined. Have a side view there. And that's just what we're doing. Just getting a nose that fits the face. That's really what we want. Most incisions are inside the nose. I do often make a small incision here to kind of help me open it up in most cases. And then, as I said, not always are we shrinking the nose down. In this instance, she had a very deep set radius of the nose or root of the nose. We actually built that up from there to there with cartilage, as well as reshaping. So, all noses are different. Another nose, if you just look at the tip area, a lot of times we'll just do this area just for suture. And one of the things that's changed with rhinoplasty, especially since Michael Jackson started, we become more and more natural with what we do, just using sutures to recontour things, not trying to take out so much cartilage, but using your own tissues and just reshaping them. And that's really what she had done there. And then sign it there. Rhinoplasty is something that can be both cosmetic or functional. Now, all the changes we saw really were cosmetic, but a lot of times people have problems breathing through the nose or sinus problems, and those can be combined with the cosmetic portion to help with the rhinoplasty. So, insurance will help in those situations. That's good. Yes, this is your anatomy lesson. That's the inside of the nose. The important thing is just to know there's a lot going on there in terms of how you function. So just making your nose smaller, that's not what you want to do. You want to make sure that as you make it smaller, your nose still works like it should. And there's a variety of things that we can do to make sure that it does at the time of surgery. Another more reconstructive nose, again, building it up. Again, sometimes we're building the nose up. And in this case, really was a breathing issue before. And by opening the nose up and making it a little larger, not only does the nose look better, but it works a little better too. Something really unusual, this woman, she doesn't know how she got this, but she had kind of this indented area on one side of her nose and it collapsed. Again, this is one of those where insurance helped out. We were able to build that up with cartilage and make her nose look more symmetrical. And then I think we're getting down to my last patient here. And this patient had multiple things done. And I put her in just because I think it's important. If you are thinking about face surgery or any facial surgery, it's great to come in with an open mind. Because if there is a benefit to doing multiple procedures at once, both in terms of safety, you only have one anesthetic, one recovery time, and it's actually less expensive when you group multiple procedures together. And I can't tell you how often patients split it up and they come back and say, I just wish I would have done it all at once. And patients really do very well with it. Anesthesia today is very safe. The case I did today was 7 hours, a 71-year-old. He did the nose surgery as well as some other things. And he did great. And people do very well with anesthesia today as long as they're healthy. So I would encourage you, if you are thinking about facial surgery, come in with an open mind and really look at the face as a whole. And she had her upper and lower eyes done, opening up that area. And then the facelift, tightening up the neck.
That makes a huge difference.
And then laser resurfacing around the mouth. And when you do a combination of things like that, it really can make a dramatic difference in one recovery and so forth. It's a really nice way to
That's
go.
the best thing. You didn't change her look. You just made her look like a younger her.
Yeah, that's the goal.
Wow.
So, yeah. And then this is, I always have to find a reason to put my China pictures in here because it was such a great experience. Cool. So, but there is a reason. There is a reason I have this. You know, I'm one of those people who said, oh, you know, we have these trips where we go to different countries through my academy, and you do pro bono surgery as well as give lectures, and they asked me to go. They asked us to go with the promise that we would get to go to the opening ceremonies of the Olympics. Well, went from there to, why don't you come a month after the Olympics? But we still got to go to China. And, you know, I thought I never could do it. I thought, I can't take 2 weeks off from my practice. There's no way I can do this. I'm on time and so forth. And I just did it, and I'm so glad I did. It's an experience I'll never forget. Well worth it. And while I was gone, the stock market dropped by about 5,000 points. It was back in 2008, so it's a good time to leave anyway. So I guess tying that into facial surgery, I mean, if you're really thinking about it, I think if you talk to people who've had facial surgery, consistently I hear, wow, that was a great experience. So if you have something that you're really motivated to do, I really encourage you to think about it and talk to some people that have had it and find out what it's like. Because for most patients, it's a great experience. And I think that's all I have. So,
How do you find the
questions?
patients that have had it? I mean, just by, how do you find people who've had
Yeah.
it? Do you have like recommendations?
We do. We have people that are comfortable talking to, you know, if somebody says, hey, what was the facelift like? I want to talk to the patient that's had it. We can do that. Kim has had most of the procedures here, so we can.
I actually did a brow lift back in June,
Yeah.
which I'm thrilled about.
So,
And I came in thinking I wanted another procedure, but I'm really happy.
but we can always have you, for whatever procedure you're thinking about, find somebody who's going to talk about it. That's very common.
Now, what's the Thermage replacement that you're going to be carrying?
It's
You
called
said.
Ulthera, ULTHERA.
Okay.
And Debbie actually has a list of people. I mean, we're just getting started. We've done some staff, and I want to have a good feel for it before I start telling people all about it. I know what the company says, I know what the FDA says, but I kind of like to see things for myself and do it myself. So, but we're going to be sending out a letter or calling people in the next month or so, letting them know where we're going with things. You know, Ulthera and these tightening procedures, I mean, I think this is the best one out there right now. It's not going to do what a facelift does.
Mm-hmm.
But if somebody younger needs a little tightening or a little lift in the brow, or somebody just does not want surgery, I think it's a nice option. And it really, pretty much no downtime, which is what I like about it.
What's the laser?
Laser, CO2 laser.
Is that an easier procedure to recover from than a facelift? I mean, because you think, oh, you know, my skin looks better if I pull it back.
Right. You know, first of all, facelift is much easier than most people think. I can't tell you how often they're like, well, that really wasn't so bad. And they're numb afterwards, they don't have any pain, they have a little tightness, I don't say anything, but minimal pain. Tightness, it's around the ears, so they can still see, like an eyelid surgery or sometimes a little blurry. So that's typically a procedure where people say, that was much easier than I thought. CO2 laser is probably a procedure that's as tough as everybody thinks. Now, it doesn't hurt, but you think of a peel or a sunburn, and that going on for a week and a half, kind of steam, your skin's exfoliating, I be cleaning 6 times a day. I don't want to, it is a little tougher than a facelift, I think, for most people. Yeah.
So why would you do that instead of a facelift?
Well, they do different things. A facelift is for relaxed tissues. When you start to get jowling here, extra skin in the neck, fullness in here, that's what a facelift will lift. When you start to get lines around the eyes, on the top of the mouth, that's what laser does.
Okay.
So think of, what if you get both? then we could do both. Like that one lady had both. She had. Now, I will say that combination, I won't do on everybody. Absolutely not a smoker, never smoked, somebody who's motivated, because it is a little tougher course. But as you saw, it can be pretty dramatic results.
Do you do most of your procedures here, or do you do?
I do procedures at St. Francis. I do some at Indiana Surgery Center over by Community South, and then I go up north, Meridian Plastic Surgery Center, up in Carmel.
Stephen Perkins up there?
It is his place, yes.
Then-
Yeah. You know, the nice thing about that facility, I mean, all three are great experiences. The nice thing about that is it's a private cosmetic surgery center, and some people.
Well, I live near there, that's the other thing.
Yeah,
that,
yeah.
You know, that's why I wondered, you know,
Yeah.
how you did, what you did.
Questions? Well, I'm fortunate to be in a fun field. I mean, this is really a great area of medicine, new stuff going on all the time, and patients, fortunately, do very, very well. So I enjoy it, and hopefully I'll get to meet some of you. I haven't already met you, and get to speak. So thanks for coming.
Thank you. All right, this is the coolest prize out there.
Pretty facelift.
And I'm not Ivy?
I think Ivy left.
Well then,
She's out of everything. Oh my God.
Loretta? We just decided we have to be present.
Kim makes the rules.
I do. Susan?
You may have a good chance of work though.
Dr. Ramsey.
What do I get?
Leticia, you said you were going to get it. Oh, here you go.
But everybody got something here, right? Did everybody get something? Do we have some?
Yes, I think we do. We brought some additional bags.
Yeah.
So come
Feel
on
free to
in
get
and-
some. You guys have stayed long enough. I
Grab
think you
some.
deserve it. If we don't have it, we'll get you some. Just let us. Yeah. So thanks for coming.
Thank you.
Yeah.